cancer care disparities are a major issue worldwide, and even within the United States, access often depends on factors like zip code and income. What are your thoughts on this issue, and also when it comes to Africa?
Yeah, I mean, I think you hit the nail on the nail right there with it, because I think the cancer situation in Africa is really becoming a crisis where we actually recently with the Lancet Oncology Commission for Sub-Saharan Africa showed that, it's about 1 million deaths per year by 2030 if we don't do something about that. And what we see, like you mentioned, is that there are lots of cancers that are really predominant, like prostate, breast, and cervical cancer. And when you look at these cancers, these are the same cancers that in the United States, you see a lot of disparities around. And these disparities are really driven by factors like genetics, maybe just being Black. In Africa, they are more predisposed to breast cancer, having breast cancer early. But a lot of them are also because of systemic factors, just like, the zip code where you live in, maybe a poorer zip code, the food you eat. And in Africa, the rising incidence is partly attributed to that because now more people are adopting Western diets and other risk factors like with HIV/AIDS. That's made cervical cancer the leading cause of cancer deaths there in Africa.
So, Dr. Ngwa, how do we close the gaps? There are some initiatives that you are leading to help address this issue. Tell us more about it.
Yeah, no, I'm very excited about a couple of initiatives that we've been working on. So one, first of all, is has really been engagement with the White House, which has really heard about President Biden's cancer moonshot. So over the past year, since it was ignited in 2022, President Biden, there have been a lot of initiatives that have extended that cancer moonshot to Africa. First, when the president hosted the U.S. Africa Leaders Conference in 2022 in December, there was a commitment of over $300 million from the private sector and the U.S. government to support care in Africa. And then more recently, we had the White House Africa Forum that was really focused, resulting in another, $100 million in commitments. So that's a really major, opportunity for the U.S. to continue to show leadership and help collaborate with Africa in addressing the cancer incident. Me personally, yeah.
So would you say that if we are to move the needle on the continent, I mean, you talk about these great initiatives, do we need more money, more expertise, more tools? Where do we start?
Yeah, we need all of the above. We actually really need more workforce. I think one of the big part of it is the workforce development. I can tell you most doctors don't want to specialize in cancer in Africa right now because they say they only have to, give a bad news to the patient. They don't have the infrastructure to be able to treat. And so we really need to build a workforce in addition to developing facilities. Recently we've committed, supporting the Cancer Center in Ghana. That's one initiative that I'm actually very proud of that we've been involved with. And that initiative, with the Ashanti King and Dr. Beatrice Adai, who is leading that initiative, would really provide a comprehensive cancer center of excellence in West Africa so that you can marry that infrastructure along with workforce development. I think that those are the key things that need to happen.